Hello and welcome. Today we have with us Dr. Elan Kumaran, a liver transplant surgeon, and we are going to discuss some important questions with him. Welcome, sir.
Good evening.
Good evening. So, sir, my first question is, now we see a lot of cases of pig organs being transplanted, especially in heart transplant and kidney transplant. So, is there also any sort of scope in liver transplant?
Very interesting question, Ishita. Actually, the biggest challenge of liver transplantation is getting the donor organ. In our country, the disease donation rates are very low, and not always a living donor is available for everybody who needs a transplant. So, to overcome this challenge, there has been a lot of research in transplanting animal organs to human beings. As you can understand, the body's immune system will always reject a foreign organ. Leave alone another person, if it is another animal being, definitely the body is going to reject. So the scientists have developed genetically modified animals, basically pigs, which is called xenotransplant. Initially it was a 3-gene knockout, and now there are 10-gene knockout pigs, from which they are immunologically less potent, and so the body can adapt and accept these organs into human beings. This is still, I would say, a very experimental modality of treatment, and there has been successful surgeries performed with animal organs in human beings in experimental setting, where it was done for a patient who was brain dead and the liver started functioning in his body sustained for only 24 to 48 hours. The success has not gone beyond that. But definitely, future is very interesting. I am sure the researchers and scientists will be able to overcome this problem, and in the future, the problem of organ donor shortage can be overcome. There are several other methods also, like there is a technology called 3D printing of organs. You know, we've already been successful in 3D printing non-living tissues. Somebody needs a reconstruction of their earlobe. You can take the photograph and then of the previous photograph, print it with a 3D printer, the cartilage can be printed and can be operated with that. But for living tissues, the research is still going on. So there is so much to look forward in the future.
And sir, now a very important question, that liver transplant, when is it the right time for somebody to get a liver transplant? Because there could be stages of liver diseases. So when would somebody be suggested to get a transplant?
So coming to reality from future, it's a very important question. Everybody knows that liver can regenerate, liver can heal itself. So commonly, patients do think that even if their liver is damaged, they can reverse the liver damage and they can start leading a normal life without having a transplant. But you have to understand that liver is an organ which is silently accumulating injury and damage, and the first sign of liver damage comes only when the liver is damaged irreversibly, more than 70%. So when somebody has developed signs of liver failure, that is the right time to actually get transplanted, because no amount of medical treatment can avoid the complications of liver failure. Like it can lead to multiple organ failure, the kidneys can fail, the heart can fail, the lungs can get affected, and sometimes these patients may not even be fit for transplant when they come to us. So that is the very important thing. So if you can divide liver damage into early, intermediate and advanced, early stage is less than 70% of liver damage, at which point they do not have any signs of liver failure. You do a blood test, you do a scan, you may be able to identify, and that is early stage. They can be managed medically. But intermediate stage is when they start manifesting symptoms, and the late stage is when they start developing complications. So apart from liver failure, there are two other important groups of liver disease. One is liver cancer. Selected patients with liver cancer also get curative treatment with liver transplantation. You know. And third is a lot of genetic disorders. There are some metabolic problems which can develop even as soon as their child is born. So such children also need to undergo a transplant, and even a newborn child, if they undergo a transplant, they will complete their entire life, 70, 80 years with the liver transplant. And you know, it's a very happy and interesting fact that the first child who got transplanted in India today has become a doctor. He's trained to be a microbiologist, and he's even got married and has a child, and is leading a completely normal life.
Lovely, sir, lovely. It was so great to have this conversation with you, such insightful details here.
Thank you, Ishita.
Thank you, sir. Thank you.